This is a story about enhancing our primary care sector to ensure cost-effective, quality and convenient care to our people. It's about how we can make things better for our patients. People go and see a doctor when they fall sick, but sometimes they are at a loss as to what their best option is. Polyclinic? Hospital? Specialist outpatient clinic? Or friendly Dr. Tan at Block 253? With so many doctors and specialists, who do they go to? Healthcare affordability is on top of people's minds, but some would still prefer to see their friendly neighborhood GP. Patients like the comfort of familiar setting and the close bonds they develop with their GP. Our rapidly greying population, longer life expectancy and changing lifestyles will increase the chronic disease burden in Singapore, with more people suffering from chronic ailments like diabetes, hypertension and high cholesterol. In 2011, 2 in 5 Singaporeans live with these conditions, and by 2020, this number is set to increase to 3 in every 5. In addition, 28,000 Singaporeans are currently living with dementia, and this number will also increase to 80,000 by 2030. And these conditions are complex and require ancillary services to better manage chronic conditions. But our current structure may not offer such a possibility. So how can we provide quality and holistic care to our patients with finite resources? How can we offer comfort and accessibility to our patients? How can we help them save on medical costs? How can we bridge these gaps?
Like many of you, I operate as a solo practice, but most of the time, I find myself spending time on the non-clinical and paraclinical part of patient care. It would be ideal if we can have allied health professionals to take over the diet counselling, the podiatrist services, physiotherapy and diabetic retinography. In that way, we are able to see more patients and provide better care to them. Patients that we are familiar with would also come back to us without having to look for alternatives.
There are polyclinics that are multi-doctor practices that provide these supporting services, but they always have long queues, and adding more doctors to the polyclinics or building more of them would not be the best solution.
Another problem we face is, it's so hard to employ and train clinic assistants these days, but without them, I have no way of handling all the medical records, administration and appointments. I've always thought of, if we have a user-friendly IT system, it will help my clinic assistant and I to keep track of medical records and manage my patients more efficiently.
Drug cost is the bulk of our operating costs. It would be great to have a system that allows all of us to pay lower prices for the medications and essential supplies. More importantly, this saving could be passed on to the patients without us incurring any loss too.
There are many ideals on our wish list, but if some of these can be implemented, that will help us focus more on the clinical aspects of care. Hey Chunkit, what would you do if you could design something better for the primary healthcare system?
Well, for many of my chronic patients, I have to send them to allied health professionals outside my clinic. Do you know of any place which provides a one-stop service where I can refer my patients to?
Well, I've recently sent some of my patients to community health centres for ancillary services like foot screenings and DRP. Not only that, I know that these centres also have dietitians and nurse counsellors to advise the patient on their lifestyle changes.
Would I continue to help my patients manage their chronic conditions?
Definitely. I would diagnose the patient and send them to CHC for tests and support services that I'm unable to provide. The results are sent back to me, and I would develop a treatment plan from there.
Sounds good, but where are they located?
There is already an existing centre in Tampines, and I understand that there will be more of these centres in the near future.
But how about in places that do not have enough clinics to support a community health centre, like a new town? How can we still help our patients?
How about having these support services within our own facility? But currently it is not possible for us to do so, as it would be difficult to house these services within our small clinic space.
What if the government could work with the relevant agencies for larger clinic spaces to form bigger clinics? We could team up with other GPs like ourselves to share the cost of these allied health services with 4 to 8 doctors in our facility. We can also share costs like IT systems, drug chasing and administration. As time is more efficiently used, it will free me up to do other important things like training at CME events, spend time with my family, and most importantly, go on a holiday. So with this new system, my patients would have access to a range of services that we located in their communities, making it much easier for the GPs to coordinate their treatment.
Patients can also benefit from claims made under the Medisave limit and recently enhanced primary care partnership scheme.
It's time and money saved altogether. For the enhancements to the primary care landscape to be successful, these primary care services have to be integrated with the hospitals. Only then we can achieve a seamless and integrated healthcare system.
After all, the key objective is to improve the quality of care to the patients and bring primary care closer to them.
We encourage everyone to share your views with us
Come be a part of the primary care landscape
together.